గ్యాంగ్రీన్ సమస్య వేధిస్తోందా? ఫుడ్ అల్సర్స్ ఇబ్బంది పెడుతున్నాయా? సెల్యులైటిస్ తో బాధపడుతున్నారా? అన్నింటికీ అంప్యుటేషన్ లేకుండా అడ్వాన్స్డ్ ట్రీట్మెంట్ అందిస్తోంది కేబీకే హాస్పిటల్. వివరాల కోసం వెంటనే 9603-999-108 కి కాల్ చేయండి. సేవ్ ఆర్గాన్స్, సేవ్ లైఫ్.
Good morning. My name is Dr. Chaturvedi. I am the CEO and founder of Swastava Cancer Care, which was founded in 2017. Till today, we have screened almost about 60,000 women for cancer. Awareness created for over 80,000 people. Then we also have given HPV vaccination to more than 1,500 girl children. Now, today is a wonderful day. We have a special guest, Mrs. Manisha Sabu, who is the vice president of a very prestigious software company, and then also CSR head of the same company. It's pleasure to introduce her. Please.
Thank you.
Yeah.
Thank you so much.
Yeah.
Actually, in India, more than 5 lakh women are detected with cancer every year. No wonder my well-read mother always insisted that I do frequent checkups for cancer. So, but then getting checkups done was always a kind of a problem, going to the hospital and all kind of things, taking an appointment. But now, with Swastava Care Center, having a mobile van which can go to even the interiors and the remote corners of country, cancer screening has become easy. Swastava Care Center is a respected member of Indian Cancer Society, and they have mobile van which you can utilize for cancer screening. One of the important things that I would like to tell you is there's only one cancer which has vaccine, which makes it preventable. It is possible to prevent that cancer, and that is cervical cancer. So this vaccine, luckily, is available at a very reasonable cost, affordable, accessible. So why not take the vaccination and prevent probability of cervical cancer?
Very true, ma'am. Actually, Servavax is made by Serum Institute of India.
Yeah.
It's a pride to India that this vaccine is being made here. Previously, we were getting it all the way from Holland, and Gardasil is being given, which was very expensive. Now it is made very easy. Now, as you rightly said, going to the hospital, getting screened is a big process. It takes a full day. Whereas Swastava Cancer Care has been doing the screening of oral cancer, breast cancer, and cervical cancer with most modern equipment that is available, along with the mammogram van. And subsequently, we are getting the best test done. That is, final test is human papillomavirus. For cervical cancer, the reason is only human papillomavirus. Even that test also is being done by Swastava.
Very good, very good.
Now, another thing is, the two instruments have come which have got artificial intelligence. One is smart scope, which on the spot can tell whether it is positive.
On the
border
spot?
case, yes.
Immediately?
On the spot. Whether it is positive, red light gives positive, amber on the border, and then green, safe.
Okay.
So that is one. Another thing is colposcope.
There's no need to wait, like you do the test and the next day the test report will come.
Absolutely not necessary. But only for confirmation we do.
Okay. I know that almost, that tells you that it's important to get further tests done.
Exactly. So that test gives us a spot test in mass screening. That is the greatest advantage. It's a small instrument which can be carried almost like a mobile phone.
Okay.
So the another thing is colposcope. Colposcope also gives similar results, and colposcope guided biopsy can be done. See, ultimate test will be cervical biopsy. The cervical biopsy is done with the help of colposcope,
Okay.
and then further procedures and all that are done.
Yeah.
Luckily, this Aragyashri program is helping all the poor people to get free treatment in government hospitals and private hospitals as well.
Yes. It's such a boon.
Yes, such a boon. And then most unfortunate thing is tobacco. tobacco is causing catastrophe. 90% of the cases are because of tobacco, they get oral cancer. And for that, we take a swab, get it pathology test done, and then confirm whether it is oral cancer or not.
Okay.
And same procedure goes again.
Okay.
MNJ Cancer, we are doing in partnership with MNJ Cancer Hospital, which is a government
Actually,
hospital.
whenever I see anybody chewing tobacco, I feel so sad about it.
It's
I
unfortunate.
feel that they don't understand what they're doing and how much harm it will cause them and their family.
Very true.
More importantly, the family.
Yes, absolutely. You said it right. And then breast cancer, cervical cancer also can come because of tobacco.
Oh, is it?
Yes, the reason for getting these cancers also is same. And atmospheric pollution, water pollution, food pollution because of pesticides and all that. That is what is creating the
What
havoc
we
now.
cannot avoid, that we have to understand, accept. But what we can avoid, like say for example, we can avoid cervical cancer by taking vaccination.
Exactly.
That is what we have to do.
Very true.
Some things we can't avoid, we have to accept.
But
But cervical cancer, it's possible to avoid.
Very true.
Then we absolutely must act because it's our responsibility.
as you rightly said, in European countries and in the United States, both boys and girls are given this HPV vaccine
Okay.
because it's a sexually transmitted disease, and boys also need protection from that so that they don't infect things. And it takes almost about 10 years for it to really brood and come out.
Okay.
So immediately, results cannot be seen.
Okay.
But
10 years.
Exactly. And early marriages in Telangana is another reason for this type of cervical cancer.
Oh.
So, what we have been advocating, and of course, you know better, is to see that this vaccine of human papillomavirus is given to both boys and girls between 9 years to 14 years with a gap of 6 months. So that is what is recommended by, and over 50.
It's only twice that they have to take, or
it.
maximum thrice,
Absolutely.
depending on age.
Absolutely.
And 6 months gaps, and then there is a mobile van which is coming to the
Absolutely,
doorstep.
yes.
So, like, it couldn't be made easier than this. And it's not like you have to really worry. The van will come every 6 months. You can take it, and you're done, and you're preventing one major cause of problem for you and your family.
And another additional thing is, Hyderabad has got more than 10,000 women who are HIV positive.
Okay, such a large number?
Yes, such a large number. And we have started screening them. Recently, we have done a screening for about 100 women. Out of the 13 people proved positive. We are
Almost 13%.
13%. And we are trying to see that cervical biopsy is done, so that final test is cervical biopsy. Once the pathology reports come.
So almost like you're telling me that every 10th person that
Yes.
you meet
That's
could be having HIV.
That is what is happening. That's the most unfortunate thing.
Maybe we need little more larger sample
Very
to
right.
really say this.
Really, yes.
But this is a probability.
Yes. So that is the real story of cancer, where prevention is possible. World Health Organization wants cervical cancer to be totally eradicated. It is possible, provided there is a will. We need to see that the vaccine consciousness is brought into people, awareness is created, and vaccine is given to those people who can't afford from the side of philanthropists and so on. That's what we are trying to do. That's how this thing is. What's our message to the women? See, as per WHO standards, once in 2 years, pap smear should be done. Self-sample can be given, and then self-examination of breast is important. So, there are techniques to do on their own.
Yes, yes.
Yeah.
The videos available very
Please,
easily.
please. What's your message to the?
My message is just be careful, take care of ourselves also. Especially the women tend to put ourselves on the lowest priority. But believe me, if we take care of ourselves, we are doing the biggest service to our family. Taking care of our health is important, not just for ourselves, but our family too. So When cancer screening is easily available, go for it. I take care of myself. I urge you to take care of yourself.
Thank you so much. Very kind of you for sparing your evening for Swastava Cancer Care and also to give a valuable message to the society, per se for the women who need to take care of themselves, because they are they have the pivotal role in the family. Not having a lady at home will be realized only when she is absent.
And even that whole procedure of cancer care, suppose somebody is detected with cancer, the whole family goes for it.
Absolutely.
Whole family suffers. It's not one person who suffers. That is why I feel it's a favor to the family if you are taking care of yourself.
Very true.
They will have good life. It is a big drain on all kind of resources.
Very true.
If anybody is detected with cancer,
As rightly said,
anybody in the family.
yeah, as rightly said by you, people sell all the properties and to see that treatment is given.
Yeah,
Ultimately, the cancer patient dies, and these people are on the street.
correct.
That is what is happening. And another misfortune, ma'am, people do not know that cancer is not contagious.
Oh, is it?
Cancer is, people do not know.
People do not know.
Do not know. And there's a myth in villages. If cancer is there in the family, my daughter cannot be married, or my son will not get a girl to marry.
Oh.
This type of myth is something we are trying to break and tell them. And also the importance of a lady at home, which is not understood till the time one loses. The health of the lady is most important. I would request you also to say how important a lady is important at home.
Obviously, everything. We can't, like, it's like backbone of the family.
Yes, very true.
So
Very true. Thank you so much. Very nice of you for having
Thank you.
spared your time, very valuable time, and given a valuable message
Thank you.
to the people. Thank you so much.
In India, more than 5 lakh women are detected with cancer, mainly cervical cancer and breast cancer, every year. No wonder my well-read mother always insisted that I get cancer screening done regularly. And now I insist for my daughters that they do this cancer screening periodically. But then it's a big hassle to go to a hospital and get the screening done and then wait for the results to come. However, one good news is that Swastava Cancer Care, which is a very respectable member of Indian Cancer Society, has a mobile van which comes to your doorstep. It can even go to remote areas and tribal areas where they can do the cancer screening. They even have one equipment which gives instant results. It instantly tells whether it's positive or negative. So I think that with so much of facility available, why shouldn't we utilize this? Another important aspect is cervical cancer vaccination. Cervical cancer is the only cancer which has a vaccine. It means that if we take that vaccine, that particular type of cancer probability is got to almost zero. So why shouldn't we utilize this big advantage that we have, where we now have this vaccine available in very affordable, accessible, and easily can be taken. So let's please go for the cervical cancer vaccination. It will help you. Another thing I feel is typically women try to deprioritize anything related to ourselves. We're always keeping ourselves on lower priority and everything else is higher priority. Believe me, when we take care of ourselves, we are actually telling the family how much you love and care for them. Because when a woman is unwell in the family, it's like your backbone is broken. So take care of yourself, prevent cancer, do regular screening. It's a way to tell the family that you love them.